Good afternoon, everyone. Welcome. It's wonderful to see so many of you here in person today and also joining online. We have more than 300 participants registered, joining both in person and virtually, representing 14 countries across 5 continents and communities throughout the United States. This global participation reflects the importance and the urgency of rethinking how knowledge is generated and translated into action for population health. With that, it's my pleasure to turn things over to Dr. Salma Abdallah to open our program.
Good afternoon, everyone. It's really warm out there, and I had to run from the other building here, so I'm still taking my breath. But thank you all for being here, and thank you for all of those who are joining us online. What I want to do in the next couple of minutes is really to walk you through why you're here today, what we've been doing over the past 2 days, and why it matters outside of this room, especially for people who are joining us on Zoom across the world. Let me first start with something that really grounded this initiative. Public health as a field has had real accomplishments over the past century. We've built a substantial body of evidence on what shapes health outcomes. Life expectancy increased, and mortality and suffering from many diseases decreased across the globe. Yet, there are still inequities and gaps between and within countries. In the United States, for example, there is a 20-year gap or more within counties and within cities, including the city of St. Louis. Many of the leading risk factors that actually lead to the premature deaths that we see across the globe that contribute to this gap are actually preventable, and we know how to address them. So the question we're trying to address with this initiative is to think about how we translate the knowledge we have into action. So over the past 2 days, we've been asking, are we producing the right kind of evidence in the right way to move the needle on those gaps? And that's a hard question because it actually requires us to turn the lens on ourselves, to ask ourselves and the field whether the things we decide to study, what counts as rigorous evidence, what gets funded, what gets published, and what ultimately reaches policymakers' desks or the doorsteps of communities is helpful to improve the health of populations. This is what the Better Ways of Knowing initiative is all about. It's a multi-year project that is funded by the Robert Wood Johnson Foundation and led by the Healthier Futures Lab at Washington University in collaboration with the Alliance for Health Policy and Systems Research at the World Health Organization. Over the next 3 years, we're aiming to convene leading thinkers across academic disciplines, community practice, and policymakers to ask a set of foundational questions on how we generate knowledge and whether the systems we've actually built over the past century is still fit for purpose in an evolving and a fast-evolving world. This first conversation focused on setting the narrative and setting the vision for the convenings coming ahead. We asked ourselves and we wrestled with the following questions among the leading thinkers we've actually convened over the past 2 days. We asked what values shape population health science, and how do those values choose what we study and choose what we ignore? We also asked, how do the systems that fund, credential, and rank research constrain or support the health outcomes that we're looking for? Also, a really deep question that lingered across the conversations we had was, when communities are generating and know the harms or the items or the initiatives that support them, what can we decide and what type of knowledge is needed to actually help them address their concerns, address the harms, and help stimulate more conversations about the things they know are helpful for them? What does it actually mean to build an evidence base that holds that complexity instead of flattening it? I won't pretend that we've fully addressed those questions. I think if I said that, the panelists would actually disagree with me when they sit in here. But I think there's real tension between wanting strong evidence that is more reproducible and more generalizable. That is sometimes a real tension that we have with wanting broader evidence base that includes community knowledge, historical precedent, narrative, and life experiences. What I can tell you is that the conversations we had surfaced a lot of structural barriers that need to be addressed to actually achieve action. If we want different outcomes, we need to be willing to examine and improve the structures that stop those actions from happening. This public event today will continue that conversation. The questions we've put to ourselves, and my hope that we've all think about today, those of you who are joining us on the panel, but also joining us online and in person, is that if we were to design a system for producing health knowledge that improves the health of the population today, how far would it be from what we have right now? What would you continue, and what would you change? Hopefully, someone who's been thinking about this for a long time as well can help us with that answer is Dr. Alonzo Plow, who I will be introducing right now, because I think for the past 25 years, he's been grappling with that question across different roles that he's had. He's the Chief Science Officer and Vice President at the Robert Wood Johnson Foundation, and he's responsible for aligning all the foundation's work with the best evidence for research and practice to improve health equity and incorporate program evaluation into organizational learning. Dr. Plow is a national leader in public health practice with over 25 years of experience, and he's currently a clinical professor of population health at University of Washington School of Public Health. Alonzo.
Thank you. Thank you for that kind introduction. Yeah, I have been around for a while. You kept saying 25 years. Really, really good to be here. I'm going to just give you some welcoming remarks from the Robert Wood Johnson Foundation. And I'm not going to assume, particularly with the international audience, that everybody knows who we are. We're a private foundation in the United States dedicated on making healthcare a right for all and not just a random act, focusing on addressing structural factors like marginality, racism, that drive people to unfair health outcomes. And we are privileged because we are private, unaffiliated with our benefactor of 50 years ago, who was head of J&J, Robert Johnson. We received no governmental funding, and we're able to use our voice in times like this very directly to address the issues of the time. Certainly one of the issues of the time, and I'm really happy to be back in the Midwest. I'll digress a bit. Born in Kansas City, so I knew that there'd be a tornado warning when I landed from New Jersey. I didn't expect the temperature drop, but it's good to be back, and it's good to be in a new school of public health in Missouri, dedicated to the kind of things that you're working on here at WashU, and it's just been delightful to spend these couple of days with faculty members here and learn more about the great work that you're doing. It's so resonant with what we're trying to do at the foundation. We talked about a lot of things in the couple of days before this meeting, but I just want to give a little bit more around this better ways of knowing. I was a public health practitioner for a long time, and you alluded to that, Boston, Seattle, King County, Los Angeles. So the thing that I say and the foundation's saying is, if the usual way we think about knowledge and evidence was going to solve these problems of health outcome disparities, they would have been solved. And problems I was working on when I was the director of public health in Boston in the late 80s on Black infant mortality would not still be a problem. So if there's something about needing to shake up what we're doing, how we're thinking about knowledge, what we think is as admissible knowledge, whose voice and perspectives and experiences are we leaving out? Essentially, we can do better. We can do better in philanthropy, we can do better in academia, and we can do better in the translation of knowledge in public health practice. And I've been privileged to be involved with all three of those sectors. So, we talked a lot about actionable knowledge, knowledge that can make a difference, that can help us solve and not just chronicle health disparities. I know a lot of us have spent our careers counting disparities. We're all trying to get past that and understand how we we make those systemic changes. And so, again, great set of discussions over the last couple of days. And what's really interesting and has been good for me is this discussions have been grounded in St. Louis. We had community leaders in the meeting. We had many references to some of the health issues in the context, going back to Ferguson, to current issues I was learning about with radiated soil in the environment, and the opportunity for the university to be a vital partner in remembering the history, certainly, of past issues and dealing with the current context of unfair environmental exposure. So we've had great discussions over the last 2 days. We solved all the problems, and there'll be a report that'll get, no, we haven't. But I think we've unearthed a lot of the things that we have to think about. And I think that, what's really good about it is that we have a good cross-disciplinary dialogue, community-connected dialogue that I think is going to help us with that way of knowing for the future that I think is going to be important to address some of the issues that we need to address in improving the public's health. So with that, I just want to say thank you. Thanks for hosting here. And I have the great privilege of introducing my longstanding colleague, Dr. Sandra Galea, Dean of this School of Public Health, super prolific writer, author, and thinker in the field of public health. Sandra.
Let me ask the panelists to join.
Good afternoon, everybody. So we're democratic in where we let our panelists sit, but now it means I have to align the names with the seats. So welcome. Thank you all for joining us in person and online. As Dr. Plow mentioned, my name is Sandra Galea. I have the privilege of serving as Dean of School of Public Health here. I've long had an interest in population health science and how we ask the right questions and how we ask questions that are consequential to help improve the health of populations. And we've had the privilege of really discussing this for the past couple of days with an outstanding group of interdisciplinary scholars, and a handful of them literally are on stage with us today. So let me introduce the scholars who are on stage. I will start on my far right, to Professor Whitney Robinson, who's an associate professor at the Duke University School of Medicine. Trained as an epidemiologist, Whitney's innovative work in measurement, particularly developing new measures for gynecologic health from electronic health records, has helped explain persistent racial disparities in care. She reminds us that better measurement is itself a form of asking better questions. To Whitney's left is Merlin Chokwanian, who is the Donald Jemison Associate Professor of Sociomedical Science at Columbia University and co-director of Columbia's Center for the History and Ethics of Public Health. Merlin's work centers on the history of community health, environmental health regulation, and racial inequality. They also lead the world's largest repository of once secret documents on industrial poisons. Merlin is a historian who reminds us that the questions we ask are never politically neutral. To Merlin's left is Mark Brown, Professor of Political Science at California State University, Sacramento, an affiliated faculty member in the Black Honors College. Mark is the author of Science in Democracy, and his work sits at the intersection of expertise, representation, and deliberation. If we are asking who gets to decide what counts as valid knowledge, Mark has been thinking about this question for a very long time. To Mark's left is Emily Barman, Professor of Sociology and Dean of the Graduate School at Loyola University, Chicago. Her work examines the history and organization of social value, how we measure it, how marketization shapes it, and what that means for health equity. Emily brings a lens we do not often apply to health, organizational theory, and economic sociology. And to Emily's left, my right, is Stuart Buck, Executive Director of the Good Science Project, a nonpartisan think tank focused on improving science. Stuart has played many roles, including as Vice President of Research at Arnold Ventures, where he led a major initiative on improving the reliability of research. He has advised the U.S. Government Accountability Office and consulted on rigorous research processes for many federal agencies. He brings the science reform perspective. So to our panelists, welcome. So for the audience, our format is I'm going to ask our panelists some questions for the next 40 or so minutes, and then I'll open it up for questions from the audience, either in person or online. So let me start with sort of the problem with how we know, and I'll start with my first question. So I'm going to ask the full panel to respond to this, and maybe Stuart, I'll start with you, and we'll go that way. So, we're having a convening around better ways of knowing, which implies that there are better ways of knowing, which implies actually the way we actually do generate knowledge is imperfect. So what is broken about how we generate knowledge? And Is the problem with the questions we ask, with the methods we use, or something more structural?
Can I say all of the above?
You certainly can,
So,
as long as you answer all of them.
okay, well, how long do we have? No, I think there are problems with the kinds of questions that we ask. So oftentimes the questions that are most of interest to academic scholars can be of less interest to the communities and to the people who are affected by that work. The way in which we pose and answer academic questions can also often be imperfect. There are many problems with publication bias identified in many different literatures. So it's this idea that it's easier to get published with a positive, exciting effect than something that is a null or negative or disappointing or messy finding. Perhaps the best documentation of this was in an article a little over a decade ago by a guy named Eric Turner and some colleagues. And thanks to the Food and Drug Administration and its review, its comprehensive review of clinical trial evidence as to a number of antidepressants, they had the full denominator of studies and clinical trials on those antidepressants. And they had access to 74 clinical trial results. What they found was that 37 of those clinical trials had positive results. They showed the antidepressant worked, if you will. All but one of those trials were published in a major medical journal. Now, the other trials were null or in some cases negative or messy. Most of those trials went unpublished, but around 10 or 11, if I recall, of those trials were published but were dishonestly represented as if they were positive results. So if you look at the medical literature on those you wouldn't even know there's 74 clinical trials, but if you looked at the medical literature on the roughly 47 that had been published, you would be massively misled as to the effectiveness of these antidepressants. And now, we don't have an FDA for public health, we don't have an FDA for economics or for many of the other subjects that we deal with. We don't have an agency that is systematically collecting all of the data that is available and all the studies that have ever been run so that we know which ones are positive, which ones are negative, and which ones are messy. But I think it's probably fair to assume that the same thing happens in many other fields, and that has been documented a number of times. Maybe I should stop there, but I think it has to do with the broader incentives within the academic system and the system that awards grants. That there is this kind of bias towards publishing, funding, and hiring people based on you're producing exciting results.
Emily.
Great, thank you. It's an excellent question. So I would push back on the premises of the question itself, which is that there's a problem, a perceived problem, that public health research no longer has the impact or doesn't have the impact that public health professionals and scholars feel that it should have. And so there's been a sort of what organizational theorists call the garbage can theory of decision making, which is that you look backwards and you find an explanation for the current, which may or may not align with the actual reason. So I'm not sure that the problem is the fact that you need better ways of knowing. I think that it requires, you're the experts, but there are such broader constrictions on the capacity of the government, on marketization, on taxation, right, that are restricting the capacity of actors to engage in public health, that perhaps the problem is not how do you know and what do you know, but the lack of willingness on the part of your audiences and stakeholders to take up the knowledge that you're producing.
So one thing we've talked about the last couple of days that I think is a big part of doing better science is the role of values in health research. From what you've heard already, public health is infused with values. We've already heard mention of equity and equality. We've talked a lot about social justice the last few days. I'm not in the field of public health, but my sense is public health researchers are very committed to various values and talk about them freely and openly among themselves. But when communicating with the public, I see a reluctance creeps in. And if you think of during the pandemic, there were really serious, difficult value trade-offs being made. But the value of protecting life as opposed to the value of education, economic sustainability, autonomy. And those value trade-offs were not always thematized, not always made explicit, very rarely clearly defended. And why was that? One possible explanation might be the ideal of value-free science, which is an idea that has been criticized and debunked for decades by philosophers and sociologists. But I think it's become something that people call a zombie idea that continues to live on, especially in the public communication of public health research. And perhaps one way to get beyond that is for researchers to become more aware of their own values and how to defend them. One way to do that is by engaging with people who hold different values. That might be communicating more with community members. It might be reaching out to other disciplines. It might be talking more with policymakers. And might even be talking with philosophers and sociologists whose expertise is in the values of science and how to communicate them. So that's sort of one suggestion I would have for better health research.
Thank you. I am a historian, and sometimes when I'm in a public health audience, I try to hide the fact I'm a historian. And the reason is this: I think a lot of historians show up to events like this where there are not other historians, and they become really kind of pedantic. Like, one of the favorite historian parlor tricks is to say, wow, you think this problem started today? Let me show you an example from 1892. So I understand these kinds of like tricks, but I will say that right now in this present moment, I've been amplifying the history card a bit more than I normally do. And so to the question of like imperfect knowledge, I actually think humanistic inquiry is more important than ever in public health, and particularly historical inquiry. I think a lot of my colleagues and myself in public health, I count myself as a citizen of both these communities. In 2023, 2024, we kind of like looked at ourselves and said, you know, we're in a crisis, we have diminished public support, there are attacks on this field by the federal government. Where did this come from? And, you know, they kind of looked around, and there was like a lot of, I think, very useful public opinion research and that sort of thing. But really, I think it's actually the historical perspective that helps you understand the kind of the long run persistent things. And I'll just name 3 of them. There have been prior episodes of mistrust in public health and medical authority since the 19th century and earlier. There have been anti-vaccination movements in this country that in some ways are more fierce than the one right now. We can learn from them. There are parallels. There's also been huge economic dislocation, I think, in not just the United States but also in the world since at least the 1970s. Some people call it neoliberalism, some people call it deindustrialization, but I think actually studying these kind of macro processes can give us a larger context and window for the moment we find ourselves in. And that dislocation has often led to kind of really kind of nasty scapegoating and sentiment that I think is rooted in some ways in the egalitarian movements of the 1960s that opened up forums like this to a lot of people in this room, but it also came with a lot of political antipathy and backlash. So I actually think a little bit more history and also a little bit more humanistic inquiry more broadly could be useful. And this is actually a very kind of cliche kind of comment. There was a scientist named C.P. Snow, who decades ago wrote about something called the 2 cultures. And he said there were 2 knowledge regimes in the university, and just kind of in a broad sense, the natural sciences and the kind of humanistic humanities. And they don't talk to each other, and sometimes there's mutual suspicion. And why is that? And I would argue that public health kind of sits at an odd place between the 2 cultures. It's kind of got a foot, I think, in each of those cultures, but I don't think we've quite negotiated where it properly sits, what it draws from those 2 cultures, etc. But I would say humanistic inquiry is one thing we can do to greatly enhance public health. And the second, just very quickly, I do think, but I make this conversation with like a big caveat, I do think the usual funding structure, which depends very heavily on the federal government, has, as we've all seen, opened a huge window for the federal government to extract huge leverage on our universities and what we can study, et cetera. And I think this is something that, you know, if somebody had mentioned it in 2015, it would have been, okay, come on, like that'll never happen here. But we've had a lot of that'll never happen here moments in the past year or so. So I think rethinking the exact nature of this relationship to the federal government, how it can still exist, but how it might have to proceed on different terms and with much more legal protection than seems to exist, is something to think about too.
I appreciate following you, Merlin. I'm also very interested in a humanistic lens on public health. I think one of the things about public health is that in its ideal form, it really does think about populations and place and people and the rich textures of what people want from their lives. And I think there's been an increasing move towards medicalization and silos, and that's exciting because medicalization seems great, and that's where funding might come from, and you get your RCTs, and feels rigorous sometimes. But if you lose kind of the soul of the population and the people, then you've lost what a lot of can make public health really strong, to be centered in place, to be centered in community, to be humanistic, and to be centered on care. And so when I think about the kinds of questions that I ask, I'm often really thinking deeply about populations that I care about. The people I respect most often have specific populations of care. I think about somebody who works in public health and who's also a liver doctor. And he's like, I just love my drunks. I wouldn't say that, but he says that. And he's like, I have a population of people who have a lot of alcoholism, who have a lot of problems. And he's like, but I love this population of people. So I'm a little sentimental. I think our care for specific people can expand and influence the questions we ask and have spillover effects.
So I tried to frame a little bit sort of the problem of what we know, although Emily challenged whether there is a problem with what we know, which I really appreciate. I'm going to come back to that. But let me move to sort of a slightly different thread about who gets to ask questions. So maybe, Mark, I'll ask you to start on this a little bit, because you've written a book called Science and Democracy that examines the relationship between expertise and representation. And, in public health, which is not the field you're in, we often talk about community engagement, but the power to define research questions still sits overwhelmingly with academic institutions and funders. So from your perspective, now sort of having spent a couple of days with your friends in public health, is this actually a problem? And if it is a problem, is there a more democratic approach to setting a research agenda?
Thanks. That's a big question. Who gets to ask the questions? Yeah, it's definitely a problem if only the researchers are asking the questions. One thing we've talked about is the pragmatist approach to research, which I guess we didn't actually directly talk about John Dewey, but from a pragmatist perspective, a genuine question is a question that starts in the world and is then taken up by researchers, and the methods and procedures of science enable a more systematic approach to that question than is possible among non-scientists. But it's not fundamentally different from ordinary problem solving. It's simply enriched by procedures and traditions and resources. And after that question is processed, it's then brought back to the origin. And you might call it a solution, you might call it a resolution, but there's a continuous circle between the world and the community on the one hand and researchers on the other. And so in that sense, really genuine questions always come from the community in one sense or another. They might come from representatives of the community, they might come from politicians or policy scholars, they might come from researchers themselves, but they're always formulated in a way to not simply answer what some people call theory-driven questions, questions that are relevant and interesting only to academics. There's certainly a role for those sorts of questions, but when research questions become interesting only to the researchers over a long period of time and not in any way relevant to the broader public, then we have a problem. And notice that this doesn't mean that research is somehow first conducted and then applied. That's often how the relation between science and public gets understood, but rather more of a iterative, communicative process.
So I think the insight that questions always come from the community in some form or another is an important insight. If I may just push you a little bit to say, okay, so is there any other field that comes to mind that is doing or has done a better job of integrating the questions it asks with what a broader sense of community would like asked, where one is able to advance the science at the same time as doing that in lockstep with what matters to the world?
That's a good question. I can't think of a field that does it better. I mean, public health is one of the fields that's already very connected to the communities it serves. I mean, I could say something more about representation. You asked about who represents the community. One pitfall that often comes about in both politics and science is that the scientists in this case see themselves as speaking for the public rather than having a form of representation that really involves communication. And if you're thinking about democratizing science, that doesn't mean only public participation. It also means a more interactive form of representation where speaking for people always involves speaking with them. There's an old slogan you probably know from the disability rights movement, nothing about us without us. And I'm sure that's made its way into public health as well, and seems like a good guideline for thinking about that.
Emily, let me come to you for a second. So you study how social value is organized and measured. So we talk a lot about impact in health research. So whose definition of impact are we using, and what does the way we actually measure impact tell us about ourselves and the questions we're prioritizing?
Thank you. Great question. So my experience is that the concept of social impact is what sociologists call a boundary object. It's multivalent. So it's dependent on context. There's no there. There's no consistency. It's based on the interests of the actors in the field. It's based on the professional histories of those who are charged with generating assessments of social impact. And I think the important point with social impact goes back to one of the themes of the convening, which is that on the one hand, we talk about values, and we believe that values drive action. On the other hand, there's a very strong and generative body of research that shows that valuation, in terms of concrete material metrics, instruments that generate metrics, they contain within them premises of what counts, and we have to align with them often in order to obtain either legitimacy or resources. So for example, what RWJ has decided counts as social impact or a grant agency often takes priority over the things that what we as a community have discussed and consensually agreed upon as values. So understanding social impact, therefore, necessitates attention to both what we culturally or sort of discursively identify as being a value, and then also understanding the reactive performative effect of what's captured and necessitated in the instruments that measure social impact as well.
Thank you. I actually have 10 follow-up questions, but I'm gonna pause because I want to get through many more questions. Merlin, let me come to you, and I appreciated your initial sort of self-disclosure about reluctance to overlean into the sort of historical pedantry. So I appreciate that, but I'm going to push you on that if you don't mind. So in a lot of your work, you've actually pursued that the idea that the questions we ask in public health are never politically neutral, either community health movements or environmental regulations. So lean into history a little bit and teach us about the conditions under which the field of public health has asked genuinely transformative questions versus safe incremental ones. When were those times, and what can we learn from those times?
That's a terrific question. I think I want to pull the question into two threads, one a positive one and one a negative one. That is when public health was a force for good and what we might call a force for things we might regret. So let me start with the good, and how did public health get pushed away from what Dean Galea, you call safer questions to better questions. There are three examples, but one I've been thinking about so much is the field of public health. Actually, if you kind of look at the heart of it, the American incarnation in particular was principally interested in kind of two populations. One were immigrant populations that were moving into large cities like Chicago and the New York City. But the other one that I've been really, really struck at is how important occupational health and workplace safety and conditions were to our forebears. It's actually like kind of the big dominant kind of framework that they conducted their that framed a lot of their research and their goals and kind of frameworks that in some ways still influence us. And we did not actually have a federal occupational health and safety sort of federal policy until like the 1970s. That was because of the labor movement, and very directly. There were workers who worked in mines there's this horrible disease called pneumonicosis, where if you work in a mine for a prolonged period of time with inadequate ventilation, you basically vomit up kind of black tar over time, and your lungs kind of show it. And what was really interesting about this is that the labor unions sort of asked people like us for help. Can you help us measure this? Can you help us kind of define levels of safety and kind of rules and standards? So I actually look to the labor movement and occupational health and safety as kind of one example. The other is the HIV and AIDS movement. I actually think a lot of these questions about community participation and the proper role of people who are affected by something actually having a seat at the table are due largely to the HIV AIDS movement. It's actually kind of incredible to reflect on it. There were people who had no biomedical training at all, but who taught themselves the lingo and the jargon and then were invited to high-stakes decisions on inclusion in randomized clinical trials, speed up of certain drug pipelines at the NIH and the FDA. So I actually think we actually have some examples here of fruitful community collaboration, the two communities here being the labor movement and HIV/AIDS activists, and there are others I could name as well. I think there are also some point public health has been kind of less of a cue giver, less of a cue giver than more of a cue taker. And the cues it has taken has been from the kind of dominant hegemonic ideology of the time. So here are some things that, public health at one point, this was like the public health orthodoxy, that people, I have epilepsy and I've had it for 20 years, that people like me with epilepsy as a disability were mentally ill and ought to be kind of cordoned off, that women who expressed physiological pain, who said that they had a lot of pain, were mentally ill, that sexual minorities this was a diagnostic category, again, mentally ill. So, there's been points too where public health has actually reflected more than anything kind of dominant sorts of tendencies, and I think it's useful to be aware of them in the present too, if that process is happening.
Let me jump to the present, Stuart. Maybe I can ask you this question that builds a little bit on Merlin's answer, because Merlin did a great job of here's history, now leads to the present. So we are in the present in an unquestionably sort of a highly charged environment. And we talked quite a bit about the issue of trust in institutions and science becoming politicized. So my question is, does that make for a better environment to ask better questions, or a worse environment? And are there opportunities in the moment? I'm asking Stuart to tackle this, but I'm going to open it up to the rest of the panel. I'm curious what you all think.
Yeah, it has been a challenging time, obviously, over the past year with the kind of political battles that have leveraged research funding against universities, often on issues that are completely unrelated to the topic of the research. And I would say that that is, I forget who pointed it out earlier, that is a kind of systematic danger in relying too heavily on federal funding. In fact, I was catching up about a year ago with a guy named Mike Lauer, who at the time was Deputy Director of Extramural Research at NIH. And he reminded me that there was some report, I think, an Eisenhower Commission created in the 50s. This was the post-war time when, if you look at grants, graphs of federal funding to research, like it's pretty much zero, and it rounds to zero up till World War II, and then it skyrockets exponentially since then, and it's kind of flattened off in recent years. But so in this post-World War II era, there was a question of, we're going to start to build out the NSF, the National Science Foundation, the NIH. They're starting to add new institutes. And at the time, there were a lot of scientists in universities who were very skeptical, as Mike Lauer reminded me, of the very idea of accepting any federal funding at all. They were afraid that would turn into political control over research. And Mike Lauer reminded me, look what happened. Here we are. That doesn't say what the answer should be going forward. I mean, it's obviously... it's kind of inherent in the political process that when you're asking for tens of billions of dollars from taxpayers every year, that there will be some level of political oversight. Whether the current environment leads to asking better questions or worse questions, so to return to your question, I think it remains to be seen. I think it's a very challenging environment, and one in which I do think that scientists and universities may need to make the case more resoundingly for public trust in science and in research. And public trust, as you mentioned, it's a two-sided process. Trust has to be earned; it can't simply be demanded, right? And I do think the very fact that we have conversations about public trust in science is an indication that there are some contingent issues here. Like, no one asks whether we trust that the number 2 is the only prime number that is even, right? Given the way we define prime numbers as divisible only by 1 in themselves, then 2 is divisible by 1 in itself. But we don't ask whether mathematicians might someday discover like a 100-digit prime number that is both even, or the prime number that is even, right? That's just impossible given the way we define prime numbers, right? So we don't ask whether we trust in math at that level, right? We just define it and say what the theorem is. And the very fact that we ask about public trust in science, I think, indicates that there are some contingencies here in which we have to, on an ongoing basis, make the public case for why the university, why the scientific enterprise does in fact serve the public interest such that they need to subsidize it to the tune of many tens of billions of dollars a year.
Emily, go ahead.
Thanks. Great question. So for me as a sociologist, like my musings about public health from the side, I think another key issue is really going back to neoliberalism, Margaret Thatcher, Ronald Reagan, right? Is like Margaret Thatcher said, there is no such thing as society. There's nothing about the market. So how can you possibly have public health in this moment of rampant amplification of the premises of neoliberalism when everybody is being trained in, several people believe that there is no social, there is no collective, and there's no need to invest collectively for collective benefit. And so that's another part of it that's very problematic with this project of public health and other similar projects. On the other hand, one of the things that's been, surfacing through this convening is that people are thinking through alternative ways of funding, of considering collective action around public health problems, right? So citizen science, going back to the AIDS example. So perhaps this is a moment for innovation, for thinking through new scenarios, new futures that may be equally effective or more effective.
Go ahead, Mark.
Yeah, I could say something more about trust in science. The discussion on that topic often gets put into sort of a dichotomy between trust and distrust, and scientists are often very dismayed at all the distrust in science, rightly so. Political theorists make a useful distinction between distrust and mistrust, where distrust is a rigid rejection that doesn't listen to evidence, doesn't allow any discussion or persuasion, and we certainly have a lot of that today with our polarized political environment. But mistrust can actually be very productive for both science and democracy. If you think about it, liberal democracy is really a system of institutionalized mistrust. If you think of the separation of powers, checks and balances, independent media, Those are all forms of institutionalized mistrust. And since science and scientific disciplines have become more and more politicized, their political dimensions are becoming more explicit, it becomes more important to think about how can we establish institutionalized mistrust within science, within public health. We already have some of that. We have procedures for public involvement, public comment, but I think we can do a lot more to find ways to make mistrust a regular and even a welcome aspect of communicating science with the public, because it's actually an opportunity. If you think of trust not as a static quality, but as an ongoing process, then when the citizens mistrust scientists, that's actually an opportunity for them to talk about their values, talk about their methods, explain why their research is reliable as well as often uncertain. And that's a way of seeing mistrust as an opportunity rather than as a threat.
But I'm going to shift us to a different topic. Whitney, I'm going to come to you, if it's okay. I've long been a big fan of your work, and in particular, I really like your work about measurement around gynecologic health, because I think what you're doing there is you are developing insight about, particularly about racial disparities, and telling stories that previously were invisible in data. So using measurement to reveal patterns in data that weren't there. So I think there's something profound there, because you've shown us that what you measure depends on what you see depends on what you measure. So tell us a little bit about how should that change how we think about measurement, and talk us through the central role of measurement in this question we're trying to ask. How does measurement inform asking better questions?
A lot of my work uses very strange designs, because often the questions that are really important to people that haven't been asked for a reason. Is the microphone on?
I'm not sure.
Okay. Haven't been asked for a reason, because there are things that are incentivized to be collected, and there are things that are incentivized not to be collected. So a lot of my work's about gynecologic health. Heavy menstrual bleeding, irregular bleeding, pelvic pain, and this is an area that has not been very well funded. And a lot of the metrics that are really important are about quality of life and well-being. So if you're using healthcare data, we code mortality pretty well. We're pretty good at coding major illnesses, hospitalizations, very acute emergencies. We are not good at capturing somebody who has pain 3 times a month that makes her unable to attend her children's ball games, have to miss work, have to withdraw from life and relationships. These things are important to people, but not necessarily valued by the incentives that drive money in the medical system or money in other facets of life. And so a lot of my work, because it's not that well funded, is driven by what I hear in my family, what I hear from people on the street. I have jewelry that has like a uterus and ovaries on it, and I love wearing it because it's a great conversation starter, because so many people come up to me and they tell me about their experiences. They tell me about their mothers and their sisters, and it's a real gift and an honor and inspires me. And so some of the questions that are not easy to answer, I say, well, it's not easy to answer, but I want to answer it. So that means I'm going to have to spend 5 years making a metric of pelvic pain from data that was not collected to assess pelvic pain. I just love that work. My colleagues are like, if it was easy, somebody else would have done it. And I'm forgetting your question, but I do think that questions worth answering are often difficult to answer, but it's worth it, and we should always be questioning what questions have not been answered and why.
So let me just follow up on that for a second, Whitney, because I think one considers measurement a technical question, like how do we measure? But when I hear you speak, I think what you mean is that measurement is actually more a political and ethical question. So my question is, do you agree with that? And if you do, like what comes next? How does one center measurement as a lens to ask better questions broadly in public health?
I do think what is measured is political. It's logistically a challenge, and I'm always interested in people who are developing better measurement and techniques. And now is a time of great growth as we think about AI and other techniques. So there are those logistical challenges, but it is political. What's collected, what's measured, and on whom. And I do think measurement is a form of representation, but also who holds that data. So for instance, a lot of healthcare systems now are doing recording of patient visits. I'm very interested in this because I want to understand communication between patients and providers, because so many patients don't feel listened to in gynecologic health. And what does that mean, not feeling listened to? So I'm very interested in accessing these transcripts. But also, some people are suspicious. Now there are all these transcripts of all these visits. Who owns this data? Who has this data? Who has control of this data? And so in the same way that I think we need better measurement, I think there is this dimension of who owns the data, who controls the data, and some people might not want to be part of a system of growing data. And so I think there's always inherent tensions there, but I do think that societies do tend to measure things they value.
Thank you. Let me now move to a question for the whole panel. So I've been asking questions about knowing, questions about questions, really, and I want to link knowing and doing. So somebody mentioned in our deliberations behind closed doors that about half of the world's publications have been published in the past 15, 16 years. And I think it's hard to make an argument that we have improved health twice as much in the past 15 years than we did in all previous history. So clearly there is more evidence being produced, and if you try to measure some link between evidence produced and outcome, clearly we're growing the gap between evidence produced and translation. So my question is the answer that we need to produce different kinds of evidence, or I guess the question, or is the question that we fundamentally need to rethink the relationship between knowledge and action? I'd love to hear from the whole panel. Who'd like to jump in? Stuart, why don't you jump in first, and then everybody else.
I mean, to me, when I hear that, what you said there, I think it does go back to the academic reward system that rewards like volume of publications, volume of citations. I have a friend who's a professor at the University of Virginia, and he said when he went up for tenure in the psychology department, they just wanted to print it out of all his articles, and then all they cared about was how high is the stack. And that's kind of a perverse incentive to create, for people to just churn out more and more articles, whether or not they're relevant or solving an important problem. I suspect the world would probably be better off if we said you get to publish 5 papers in your lifetime. Better make sure they're good. I don't mean that for real, but it's just a kind of thought experiment to provoke. What would happen if we measured the quality of output as opposed to just the sheer quantity? So it's another case of measurement. What are we measuring, and what are we getting for that? And on that point, I was going to add, on that point of measurement, this is not a public health example, but it's one that just floated across my social media feed recently. There's this educational software called iReady. Have you heard it? What? Do you have opinions? I don't know. What?
I have a 7-year-old and an 11-year-old, and my 11-year-old hates iReady.
Okay, good. That was going to be my point. So glad to have independent confirmation. But so there are a number of studies that have been done on this software, this personalized education software that a lot of schools have bought. And the studies supposedly say, I don't know if I even believe them, I haven't reviewed them, but that it improves test score performances by a few points. That we're measuring test scores. Those are easy to collect. They're centralized databases. But then there's been this discourse, and now confirmed here, that kids seem to hate it. It makes you listen to these like boring written instructions out loud every time, won't let you skip. If you're the slightest bit advanced or gifted or talented, won't let you skip ahead in lessons. And so they find it excruciatingly boring. Now, is it worth raising test scores a few points, even if that's true, at the cost of making kids hate their lives and hate school? Because we're just not measuring that. Like I think that's an important consideration for all these.
I have questions to questions, but let me hear from the rest of the panel first. Emily, go ahead.
Just very quickly, I want to point out the example of management, where it's not the quantity of publications, it's whether or not you have them in their aid journals, and so you only need a very small number of them because they have to be very high quality. So you have an alternative model available to you. And I would just say in response to the question of the volume of publications has increased, why hasn't the impact increased? Is again, it's supply and demand. And so the question of, what is being communicated, how is it being communicated, and how much will there is on the part of those who would take that knowledge and move forward might also be part of the challenge here.
Before we go to Mark, let me just piggyback on something, because both Stuart and Emily said the same thing about quality of papers. So I'm not sure that I know what that means. Like who is the arbiter? You mentioned the journal. Journal editing is a very subjective process. I know a few journal editors, and, they're not all that. So I just want to challenge you both and say, do you really mean that? Do you really want us to create some sort of arbitration of quality that is going to determine whether papers are any good?
We already have that to some extent. Yeah, you're right. In economics, people care if you publish in one of the top 5 journals. Like, they care about that more than if you churn out a bunch of slop that's in, some, pay-to-publish journal. So we're already arbitrating quality to some extent. But yeah, I just think we should, to the extent we're incentivizing just overproduction of articles, that we need to be trying to measure variables that are at least somewhat orthogonal and where you can't maximize them both at the same time.
So wouldn't citations do that? Because if a paper is useless, no one's citing it. I'm just trying to push us practically, because you haven't convinced me, either of you, that quality is a measure, because I know the people who judge quality, and I'm telling you, moving along. But citations say you publish a paper and you all think it's worthwhile, hence you're going to cite it. So what's wrong with that? We have that measure.
I thought people cite papers just to show off, or in part. You really think people have read all the papers they cite?
No, but at least they're citing things that they think are relevant.
Right, but it might be more relevant to their reputation than to the knowledge being produced.
So you're on the quality side?
I'm not sure what the debate is, but
well,
yes, I'm on the side of quality.
Let's reduce the debate to saying, if we're going to evaluate usefulness of papers, we're going to have some sort of quality metric versus some sort of quantitative metric. And I'm trying to understand what that quality metric is, because I have not encountered it in my career.
I don't think it's like an algorithm where you put the paper in and equality or not. I think it's a process. And so I think one way to create a process where we're doing, because I think I want to go back to the stat you started with, that there's this increasing disconnect with the volume of papers, the publication volume, and actual return we get on that, however we define that, the action part of it. I suspect if we had to answer what is the problem with having so many papers, it would be something like this. And this is a multidisciplinary, multi-method room. But my guess is we would all say a lot of these papers are very derivative. They kind of switch, another variable for, another musical chairs for the variables, but same kind of fundamental thing. Very narrow kind of hypothesis testing. There doesn't seem to be any kind of big picture thinking in that sort. So to shake that up, I think one thing you can do is actually have more of these kind of multi-field, multi-method sort of mixes. And I think if you want to think structurally and institutionally about it, there are actually a lot of impediments to those things happening. So I felt this very keenly the first time I served on an NIH study section. It seemed very much to me that I was seeing Thomas Kuhn in action. Thomas Kuhn is the historian of science who invented the term paradigm, and the basic Cliff Notes version of it is scientists are political animals, whether they realize it or not, and they tend to kind of go into little clans and they protect their fiefdoms, even when more and more evidence seems to question the reigning assumptions of the fiefdom. And I think you have some of that operating with the glut of publication. So if we can kind of break paradigms, or at least challenge paradigms with more kinds of convenings, actually like this one, where people kind of have to hash out fundamental differences, we might get less of that kind of derivative sort of research that I think is what you see with the glut. Yeah.
All right, I'm going to ask one more question for the whole panel, and then I'm going to invite questions from the audience. So you can start preparing for that, either audience in person or remotely. And maybe Whitney, I'll start with you. We'll go this way. So the question is, what does better look like? If you could redesign the system of knowledge generation relevant to public health, what would it look like? How would you prioritize question asking? How would you prioritize how we fund them? How would you prioritize how we publish them?
We've talked a lot in the convening about community and asking questions that seem relevant. There is a tension because there's something important about basic science and letting curiosity lead you. But I think for public health, a substantial sense that this is kind of relevant and interesting to people is important. As far as funding, I am attracted to modes of funding that think about maybe long-term funding for people versus discrete projects. I think some people are kind of playing around with that. And that could be an interesting model, although then you have to think about the incentives there. I think just curiosity and playfulness are underrated, and I don't know how to measure that. But I think that I love best when I'm talking about ideas with colleagues who really want to push and pull and ask questions in weird ways and bring in something from a field that doesn't seem relevant. And so in my dream world, if I could incentivize more playfulness with ideas, more engagement with people about questions that kind of matter to like the very general public, that's what I would do. So easy.
I have a negative and positive one. So I think the negative one, I really feel this so keenly because my lack of knowledge and my lack of seriousness towards this issue was very much exposed to me last year, which is that there are so few kind of legal bulwarks against the sort of attacks that we've seen this year. And I was, I mentioned the convening that I spent my last year giving a crash course to myself on constitutional and administrative law and learning about all the little holes that people who have attacked our funding agencies have exposed. So I think the first thing I would do if I could reimagine things was actually to fill those holes. And I'm very glad to see so many legal scholars actually have been coming in some ways to the rescue and kind of crafting what the kind of caulk for filling those holes might be. If those holes were filled and I could redesign things, I would like to see much more holistic methodology invited to these large agencies. Partially that's out of self-interest. I work at an institution where the VP of research has made very clear to me that he thinks my research is storytelling junk. And I don't appreciate that, I don't think it's storytelling junk. I actually think it's like really important and actually addresses things that certain other methods don't. But the NIH will never reward this research. Why? I think there's like lots of, I've been interested in ethnographies too. There's so much enriching ethnography and insight you can get from ethnographic research and just literally sending one person to some town and studying the dynamics of that town, even if it's not quote unquote generalizable, at least in the kind of positivist sense that we usually think of. It's still incredibly insightful. So I would like to see kind of more methodological holism. And this is not an attack on kind of the conventional methods either. I find them tremendously useful. And again, I think you get better questions when you get more mixing.
I would say something pretty broad. I guess I would want public health to become even more thoughtful and sophisticated about its relationship to politics. I think as a field, it's probably much farther along than a lot of disciplines, but there used to be something called the social contract for science, where politicians would give science money, no questions asked, no strings attached, and science would produce knowledge, technology, and medicine. And that's long been broken down. And the dominant alternative seems to be very narrow economistic approaches where the value it's demonstrated simply in narrow economic terms. And public health, I think, is really well positioned to be more explicit, partly in talking about values, to demonstrate its value to the broader society. And one way to think about that is to say that the research is political in the sense of having political dimensions, relevance, and so on, but it's not politics. Politics is a particular kind of activity, and when you're doing public health research, you're doing some form of engaged science. You're not doing politics. And that distinction, I think, can be helpful for communicating with the public and for finding ways to restore public trust, because we're really at a crisis in terms of trust in science and trust in experts and universities. And so I think all university disciplines need to get a lot more thoughtful about their relationship to politics.
So I will say that sociology had a identity crisis. It had a tremendous moment of impact in the 1960s and has declined since, but it just keeps doing business as usual. And it feels like public health is having similarly reflection. And I know I'm a academic, I always want to get an A, but I do think having these kinds of convenings where people can take time out, it's like an off-site conversation about what is going on in the discipline and how to improve it, I think is incredibly important. So more of these, I think, would be valuable.
Given my role, I think about things a lot from the lens of policy and funding coming from government sources, but also philanthropy as well. And so my advice, and this stretches far beyond public health, is that we need to be using the experimental method more often as to scientific funding and how it's handed out and how decisions are made. So for example, like NIH peer review panels or study sections tend to depend upon like kind of consensus decisions. And someone who doesn't like a grant can probably very much lower its chances of getting funded by giving a low out of impact score. But if you think about it, think about the history of scientific breakthroughs, like most breakthroughs were not approved by a panel of 20 people as the consensus view of the field ahead of time, right? That's almost, by definition, not a breakthrough. So I feel like we have a peer review system, and this is just one of many examples, where we're quite possibly selecting for kind of mediocre incrementalism rather than for outside-the-box thinking. And so we should try out different methods of peer review, just as one example. So like we could try a system where if we look for grants that have widely divergent opinions, some people love it, some people hate it. That seems more likely to be characteristic of a breakthrough or a potential breakthrough than 100% consensus ahead of time. So I feel like we need to be doing that kind of tinkering with the scientific ecosystem more deliberately. And I mean, we should be running the scientific ecosystem as if we're scientists.
So I'll take a couple of questions from the audience. Anybody here is welcome. I'll start with a question from Zoom until somebody lines up at the mic. So maybe Whitney, I'll direct this to you. The question is from Zoom, which is, I work in the Pacific Northwest of the US, and indigenous communities are insisting on not just collaboration, but co-design, co-ownership of research. Might these ever-expanding scientific relationships become a more central model for public health research?
I do think that there is a growing interest in working more deeply with communities as far as them setting priorities, thinking about what we measure, thinking about what we do. A lot of us were not trained in that model, coming from a traditional public health background. And so I think efforts like yours, we need to learn more about. We need to learn more about this, because being in relationship with people doing research is difficult. I think some people think, it is a skill in and of itself. So I think there is a movement for more of it, but I think it can go wrong. And so I think some people are hesitant because they don't want to go wrong, say the wrong thing, damage relationships. And I think that's important. But I think we also need to learn more models to be more courageous and try to do more of that work.
Thank you. Why don't you go ahead?
Yeah, thanks. Great panel. And so the question I want to pose is sort of turn the question that's on the screen around and say, maybe we're not doing better ways of knowing, but we're not doing better ways of listening. And that I think we're not understanding what the community needs. And, you know, it also might be about translating. And I was thinking a lot about the two sort of big pieces of turmoil we've had recently, the pandemic and the local example of Ferguson. I think, you know, I do a lot of work in rural health. We don't really listen to rural people. And we're, if I can say it, I think in academia, sometimes we're pretty arrogant about, we think we know the answer, and we say we know the answer, and we thought we knew the answer in public health. And we just said, this is what you have to do, and we know what it is. And they were like, hell no. And the same response happened, I think, in the Ferguson example. I don't think we really listen to people and what they really need, or we don't really translate why we're saying what we're saying very well to them to say exactly, you know, they cared about freedom and economics and all that. So I'll leave it there and see what the response is.
Marilyn, maybe you can give us a bit of a perspective on that through your lens.
Yeah, I mean, I think that's actually a case for more humanistic inquiry. And I'll give an example of someone who I think does this very well, listening, and then gets really great insights that are applicable to actual action. And it's the sociologist Arlie Hochschild's Strangers in Their Own Land. And I think she's got a new book on Eastern Kentucky as well with kind of similar questions. So for those who don't know this book kind of made a big splash because it came out, you know, very shortly before the 2016 election. But Professor Hochschild basically spent a number of years living in Lake Charles, Louisiana, which is an incredibly economically depressed town and also a very polluted town. But what she finds there is that a lot of the residents there hate the EPA. They think it's some kind of symbol and encroachment on their life, and they blame all kinds of people for this, but not the kind of economic structure that is responsible for the economic deprivation there. She's incredibly respectful. You know, she listens to, you know, kind of vile sentiments that express, but it's not a condescending book. It's actually an incredibly empathetic book. So I would like to see more books like that in public health, because I actually think it's a public health book. It answers the question of why do people who suffer from pollution, why are they often opposed to more rigorous or more robust kind of pollution laws? And you could import that question to the question of climate change, right? There are lots of people who are living in areas that are going to be devastated by, you know, tornadoes and other extreme weather events who hate any kind of climate change adaptation or mitigation. Why? These are public health questions, but I think these tend not to be the sorts of books or products that are produced in our field because of certain kind of methodological dominance that exists. So if we can kind of open up the methodological basket a little bit, I think we can get better at listening. I think we can have different kinds of questions asked and different kinds of products that lead us to kind of more empathetic dispositions.
And I just wanted to add that one of my big frustrations with a lot of the recent federal cuts is that a lot of them were workforce development. Like, we need to have people from rural communities who know rural communities. We need to explicitly value that. And it does matter who does the research. Somebody who's really from a place and is rooted in a place is gonna be able to get this faster. And that is a frustration. And even with the EPA, there had been moves to like do more social science and listening to communities as part of an initiative to make it more responsive. So you don't just have people who are collecting water samples and then going away and then making decisions without considering people. And so much of that has been cut. And so I think that's a move in the wrong direction.
Joe, go ahead.
First of all, thank you. It's been amazing. I've taken so many notes. I want to call out, thanks for representing occupational health. I played Little League at Hamilton Park in Fort Wayne, Indiana, where Alice Hamilton is from. Alice Hamilton's the single most important person in my mind in American public health. 12 miles from Loyola University, Hull House, where she did most of her sentinel work. So occupational health representing here, so thank you. As a scientist, in the middle of the pandemic, there was a sentinel moment for me that I realized we were losing in public health. It's when we said, trust the science. For those of us, I was in the Army, and we study Deutsche Physik, we study Stalin, we study trust. That slogan, that saying is transcendent through history in some way, shape, or form. And those of us who have been trained and have an ear for it, that is very scary. And I wonder if you have any perspectives from your disciplines, either sociology or as a think tank or a historian, like how do we better frame? Because when did we become afraid of questions? That's what I want to know. When did we get afraid of being questioned as scientists? At what point did we say, just trust us? I wonder if there's some allegories there, if somebody could speak to that.
Maybe you want to take that one?
Thanks so much for a fantastic question. I actually have been struggling with the general gist of your question as well, which is like, what are the alternatives available to scientists to make the case to an increasingly skeptical population about the value of science? I'm sure there are people maybe here who have ideas, but I too am, flabbergasted and look forward to learning more about strategies available.
Like one more question. Go ahead.
Hi, thank you again for this panel. I wasn't going to ask this question, but Tim actually inspired me to get up and ask this question. So one of my dissertation papers, I wanted to look at the community level impact of the Ferguson Uprising. I'm from St. Louis. I'm a social epidemiologist. I thought it was a very fantastic design. I worked as a local epidemiologist, so I knew that the Missouri data existed to be able to design this study using a disaster framework. I was very excited about it. I got a rejection letter from the Missouri Department of Health, and in the rejection it said, we're not going to give you this data because we've done a preliminary analysis, found it to be non-significant, and we think that you don't need the data to do this study. I think that was probably a political response. This was in 2021. So even though I think that the science, deserved to at least have a chance, it didn't even make it to publication, it didn't even make it into SAS. It was politicized on my behalf because of what was happening in the world, even though this study was in the making since 2014-15, because I'm from St. Louis and it was about Ferguson. So as an early career scientist, I think my question is, do you have advice on what it looks like to continue to pursue your scientific interest at a time when your work, which because we are political animals as scientists, is being politicized in a way that doesn't allow you to actually get to the point to create the actual science? Thinking about the ways that our questions are politicized, one of the reasons why maybe the quality question about papers is not a good question is because there are so many papers that never even make it to publication because of all the different gates that we have to go through just to get to that point. So do you have suggestions in this climate for early career scientists for their work that's been politicized?
Well, I think it's a terrific last question. So I'm going to ask the panelists all to answer that very briefly. How's that? Stuart, let's go this way.
Yeah, I'm sorry, I don't have any advice for you in particular, but I would just say from a broader policy perspective that we need to have more access to federal and state data sets that are routinely collected, and more access, more easily available access to the kinds of research data that the federal government funds the collection of when it funds research grants at universities. Like we just need more data access, period.
Thanks. I'm sorry that happened to you. Something similar happened to me with my dissertation where I wanted to include a United Way. They declined to participate, and I found out a few months later that the CEO was being investigated for fraud and was convicted. So the way I thought about it at the time was that when we study particular empirical instances, we are thinking of them as examples of a case, right? A broader phenomenon. And there can be ways to think about other examples of the case or a related case that gets at the same societal problem that we want to solve. And so can we pivot so that it becomes empirically possible to study it in a way that we can not only get the data, but we can make a claim as to why it matters, either theoretically or empirically. So keeping in the same, what is your interest, what's your passion ballpark, but figuring out a way to make it operationalizable is what helped me with my dissertation.
Yeah, I don't, well, I'll say first something about the trust question and then something about the politicization. So it might be consoling, but also depressing to remember that there's a decline in trust, not just in scientists, but in almost all social institutions. Government, media, the courts, it's, if you look at the graphs, trust has gone way down. And there are a wide range of explanations. There are bottom-up explanations. Economic vulnerability and deindustrialization are a big part of it. Racial anxiety on the part of a lot of white people is part of it. And it's a broad trend, and it also relates to social trust among individuals in everyday life. But there are also top-down factors. There are politicians who exploit divisions in order to, get votes and make a career. And from what I know of the data, there's actually more polarization in the political class than among voters. That we are very polarized in terms of political opinions and interests, but there are areas of overlap. And one remedy is to find ways to seek those out, to talk to people in rural areas, and recognize that you might find some common policies that you can agree on, especially if you're focusing on the local level. We have something happening called a nationalization of politics, where local and state issues get framed in terms of the national debate. And you have liberals reading the New York Times every morning, but don't read their local paper. Probably conservatives too. But at the local level, it is possible to find agreement if one focuses on policies and not necessarily the reasons behind them. And listening to people is helpful, not always because it will lead to different views or different opinions, but because when people felt listened to, they're more willing to lose. And democracy is about being good losers, and we've lost the ability to be good losers. And we have a bad loser in chief in the White House. So that's kind of a few things to think about there. In terms of, I have tenure, so I have it easy in terms of addressing politicized issues. I tell my students, find your people, find a support network, and be clear for yourself about the value of what you're doing and what it means to do research, what the purpose of the university is, why it's important. And I think, for me at least, and the students I talk to, those are resources that can make you more ready and willing to put up a fight when people unjustly challenge what you're doing.
I have a narrow and broad kind of answer. The narrow answer is this. When I heard that from you that a government body was not giving you data that presumably was collected by the government, I said, you're in luck, because I'm a freedom of information law expert. And I actually will talk after, but I recommend you invoke your state's freedom of information law to the max, because I believe you will win this if you push it that way. It's a legal instrument that I think is actually very underused by people in public health, but oftentimes when you get this kind of stonewalling and obstruction from public health agencies because of political sensitivities or whatever, there are researchers who have used freedom of information laws to get that kind of data about pollution or spillover effects from police violence or whatever else. I think broadly is don't go at it alone. So I'll give you a very specific example. There are lots of states on this topic of data that right now are making it actually very hard for researchers like Whitney to collect data on pregnancy-related deaths. And the reason is they don't want people to study the potential consequences of the Dobbs ruling. But my colleague, Julie Maslowski, has been at the University of Michigan, has been it's almost kind of this like subterranean sort of network with other researchers where they've been kind of finding out ways they can piece this data together from non-governmental sources, whether it's asking trying to get the data from other kinds of unlikely places and so forth. So if you can find other people who are facing the kind of roadblocks you are, it's a lot better than doing it alone. You know, if you don't got to carry the burden of studying a politically radioactive topic on your own shoulders. So try to find other people who are kind of involved in this. And these reproductive health scholars, I think, have been one very inspiring example, at least for me.
I love a lot of these answers. And also, we all need to have a historian as a friend, is what I've kind of learned from this. My answer is a little bit lighthearted. I kind of think about it as I try to stay ready so I don't have to get ready. And I always think about a colleague of mine who was an occupational epidemiologist who did work on like radiation exposure. And I remember thinking, you know, this is a field, he was like one of only a few people in the country doing it, just a very small field at that point. And then there was, I think, the Fukushima nuclear plant disaster in Japan. And suddenly he was on every television show. Like he was everywhere, you know? And so sometimes you can labor for decades, you know, doing your thing, not really having much to do, but carrying your interest, honing your skill, and then your moment arises. And I often think about a career as being ready for that one moment when it arises. And sometimes you don't know when that's going to happen. So that's how I think about it.
Please join me in thanking these excellent panelists. I'm going to invite Dr. Kumaran Rasanathan, who's the Executive Director of the Alliance for Health Policy and Systems Research at the World Health Organization, to give us some closing remarks. And maybe we, the panel, can walk off. Kumaran, over to you.
Yeah, I'll come. Good evening, colleagues, and thank you, Sandro and Selma, and to this wonderful panel. And it's a long way from Geneva to St. Louis, even without the tornadoes. But it's been my pleasure to come here with my colleague Robert and see that Sandro and his colleagues are very much succeeding very quickly in making St. Louis a real center for leading thought on public health for the state, very much located in this place, the state in its specific context, but also for this country and globally. So thank you for the invitation. The question from this panel around this idea of better ways of knowing and around our practice of public health research was, St. Louis, do we have a problem? And there were differing views on this. Right? Some suggested, well, perhaps we don't have a problem in our practice, but the challenges, as Emily said, are the broader political context. Whereas others really identified some key challenges. So if we take a long view, and COVID has been mentioned, so let's start with COVID. The Spanish flu of 1918 killed about 50 million to 100 million people globally at a time when the global population was about 1 billion people, 1 to 2 billion people. At that time, by 1920, after the pandemic had finished, the global number of deaths a year was about 60 million. Right? Global GDP per person, PPP, was about just under $1,000 per capita, right? And the global Gini coefficient of inequality was hard to measure retrospectively, but probably between about 0.55 and 6. Right? So where have we gone in 100 years? And I'd suggest that it has been a time of tremendous progress that public health and public health knowledge has contributed greatly to. So we had COVID, for all the challenges, for all the suffering, for all the traumas. The sort of floor on global mortality for COVID was about 15 million. It was probably, the excess mortality was probably more than that, but I think it's fair to say likely to have been less than what happened in the Spanish flu. The global population now is 8 billion, so much more. Global life expectancy in 1920, as I said, was about 30. Now global life expectancy is over 70 years globally. The number of people who die each year now is about the same as it was 100 years ago, despite the fact that global population is so much greater. Global GDP per capita is about $12,000 or $13,000 per capita PPP, so much greater than 100 years ago. And interestingly, the global Gini coefficient of inequality is actually pretty similar to 100 years ago. But the difference is that whereas 100 years ago, until about 1980, inequality was mostly an issue between countries, now inequality for income and also for health is concentrated within countries. And it's that within country inequality that is giving fuel to that dissatisfaction and the suggestion that we do have a problem. Now, I come from a world which has had a 25-year paradigm that has contributed greatly. Child mortality globally has halved, even as childbirths have increased. And yet, this year, when we get the data next week, I'm pretty sure we're going to see a stagnation in child mortality reduction, or even an increase for the first time. So this paradigm, for all its success, as Kuhn would say, is now failing, and we need a paradigm shift. And I think we're seeing the same challenges when we hear this dissatisfaction from everyone except Emily, that our ways, our paradigm is failing, and it needs to change rapidly. Because the question isn't, have we achieved so much over the past century in terms of public health and public health knowledge, but what are we going to achieve over the next century, right? And that the social compact that drove the investment in science, the affirmation of public health, much of this progress, that is also failing in our polarized societies driven and riven by inequality. And so I don't think we can stand still, because also public health, unlike sociology, is not a discipline. It's a melange. It's an art and it's a science of many different disciplines. And we saw that today. We have history, we have sociology, we have political science, we even have social epidemiology, I understand. And so that is the challenge. As the world is changing so rapidly with inequality, with wars, with climate change, with rapid technological change, artificial intelligence, and if our paradigm no longer works, how are we going to respond? How are we going to adapt? And how are we going to anticipate? And I think our hypothesis in this work of Better Ways of Knowing, yes, we need to listen more. Yes, we need to understand that we must still be able to contribute so much. We shouldn't be dispirited, but we do need better ways. And I think that the panel has really identified some of those better ways. We do need to think about more of a focus on solutions. We need to genuinely follow as much as we lead and allow and support communities taking leadership in all their diversity. We need greater methodological pluralism. We need to communicate what we do better. And we do, I humbly suggest, need to reform the university paradigm, reform the incentive structures, really question ourselves, because that change will either come from without or within. And I suggest that the outcomes will be better if it's driven by people who believe in the university and who recognize its strengths. So that is the aim in our Better Ways of Knowing. This has been such a rich conversation. I've been so inspired to hear what you do here in St. Louis. I will take that back to Geneva. I have 4 copies of the publication produced here on people's stories during COVID that I will share in Geneva. So that I leave very inspired. I believe there can be better ways of knowing, and better ways of listening. And I'm sure that you here in St. Louis have so much to contribute, not just to your community here, but to the country and globally. So thank you so much. And I'll hand back to Salma to close.
Okay, so I'm going to keep it brief because I think Komunan said almost everything I wanted to say, and he did tell me I'll surprise you with what I will have to say. But I wanted to ask a question earlier, but we didn't have a lot of time because a friend of mine texted me and said, are you all just cynical because you're doing this work, as the panelists were speaking? I don't think you were cynical, but I don't want to speak on your behalf. I think what you were saying is that we think we can do better. So I just wanted to my friend who's listening online to say, and to everyone who's listening online, that I'm actually pathologically optimistic. I think I'm optimistic because I think what we're doing here matters. Over the past 2 days, I think it's been very energizing to hear people think about the foundations of the work they're doing, but also question those foundations, even though they've spent a lot of time on it, because they genuinely believe that we can do better to improve the health of the population. It was also daunting because a lot of the solutions or ideas of solutions we came up with require structures, and structures are very hard to change. So I think we need to keep the optimism. I think we actually have to be quite the opposite of being cynical. Just concretely, for anyone who's interested in this work, there are 3 things that we're really hoping to push through this work here. So the first one is we're trying to create outputs that are not going to take 2 or 3 years to share with the world. We're going to try to create outputs that are accessible to people across the globe. And if you have any ideas on how we improve better ways of knowing for the health of populations, please reach out to us. Also ideas of how we can share work that is not just in journals, even though I'm a fan of journals. And you can see that I try to publish in journals as much as I can. But we're also thinking about global learning, and that's what I thought Komunan is going to talk about, so I'll talk about it now, is that Komunan and Robert, his colleague who's here, they're leading a global learning process as part of this initiative. We're going to work with 4 countries across the globe to try to understand how do they achieve change. And I'm really excited because I've seen some of the applications, and I think the learning we'll get from those case studies would be very helpful for the United States. So we're not just exporting our knowledge, we're also importing knowledge that is really important from across the globe. And the third thing that I'm really excited about the next few convenings. It's been really tiring. I think I'm going to take a break tomorrow or the day after tomorrow. I thought we're just going to be sitting in a room. It's going to be easy, but it actually takes a lot to listen to people like Merlin, who's going to teach us about history. And I think I'm really excited about who's going to teach us what in the next couple of convenings. We're going to take the learnings from now and try to implement them for the next convening, which is going to focus on working with policymakers and politicians, but also future convenings that really focus on community learning. So we're really excited about this. The last thing I'll say is that one comment I think I heard a lot, maybe in different formats over the past few days, is that we do think public health can do better. We just think that it needs to evolve because the world is evolving very fast. I think this initiative is a bet that if we examine the structures that need to be addressed and hopefully contribute to changing those structures, we can have a system that is more rigorous, but is also more responsive and hopefully more consequential in improving the health of populations. So thank you all for being part of this.